Hello, we're going to talk now about physical activity and exercise after the gastric sleeve or after bariatric surgery in general. It is very important for patients to know that they should be very active after a bariatric surgery. We usually recommend our patients to get out of the bed in the afternoon the same day of the operation. And from then on, patients should avoid staying in bed. They should be very active. The day after the operation, we usually send patients home. Our hospital stay for most of the patients is one night. The following day, the patients go home and they're going to be able to do their normal life, go back to their normal life as soon as possible. Patients can walk, can go downstairs and upstairs, can go out and walk, go to a mall, go to a supermarket, and go back to a normal life as soon as possible. We don't recommend patients to drive during the first 10 days, but after that, patients usually can do it if they feel like the recovery is enough for them. Exercising or being active is very important. During the first few days or first few weeks after the operation, patients should avoid staying in bed because that can avoid complications like the formation of blood clots in the legs and pulmonary congestion that can lead to pneumonia and other pulmonary problems and respiratory problems. Once the patient feels that can have enough intake of calories and liquids and become active again, patient is ready to start exercising. We usually recommend patients to start exercising 1 month after the operation. You should start doing at least 45 minutes 3 times a week of any exercise you like. Any physical activity can be useful. When patients have severe obesity or morbid obesity, patients usually tend to be more passive. They have patients are sedentary and they have to start exercising slowly. So you can go to a gym, you can start walking a treadmill, going out to a park and walk, and do as much as you can. The limit is your own feeling of tiredness. If you're not tired, you can go on and move to exercise 45 minutes to an hour, 3 times a week at least. If you exercise after bariatric surgery, you want to keep your muscle mass. Every time a patient loses weight or a person loses weight, the weight loss will imply a loss of muscle and a loss of fat. If you're exercising, you're going to lose more fat and less muscle. And if you keep your muscle mass, you're going to feel better. Your aesthetical result is going to be better. And you're going to adapt better to the changes that come after the big weight loss. Exercising is also very important to keep the weight loss in the long term. If after a year that you finish your weight loss process, you're exercising, that can allow you to stay out of the recommendations for short periods, or like do some like cheating a little bit. You go to a restaurant, you want a dessert, occasionally you're going to have a drink, you're going to have a beer or something. If you're exercising, that will help you not to gain weight. If you're not exercising, it's easier to gain weight after a big weight loss. So exercise is very important. It will make you feel better, will help you keep your weight off, and will help you adapt to the changes after bariatric surgery. You should try exercising at least 1 hour 3 times a week. If you want to do more, it's going to be better. But at least that timing will help you keep your health, keep your muscle mass, and make you feel better. Thank you.